this is really the core of what I want you to understand when you leave here, is how lithium moves through the kidney and causes renal dysfunction. Once you understand this mechanism, I think you'll really be less fearful of it, and you'll also understand ways to treat this. Now, there's one thing I will say as a sort of a caveat there, is that the preferred medicine to treat polyuria is not available in Australia. And I am hopeful that you all, having heard this, will now petition, and I've talked to other people in Australia. I've consulted with the state hospital system there about the need to have this medicine, which is called amiloride, in Australia. It doesn't exist by itself, and it's unfortunate because it's the preferred method for treating the polyuria related to lithium. And I'll explain why in a second. So this looks very complicated, but don't be scared. It's pretty simple in a way. Lithium's an ion, very much like sodium. So in the glomerulus, lithium is freely filtered just like sodium, and then they both get reabsorbed. Because lithium and sodium are treated fairly equally for reabsorption, one of the ways sometimes people become lithium toxic is when they become hyponatremic. And how do people become sodium depleted? The usual scenario is somebody has losses, typically GI. So they have lots of diarrhea or maybe vomiting, or if it's really hot, you have somebody who's sweating a whole bunch. It's not the loss of sodium per se, it's the fact that these people replete themselves with just plain old free water. They don't give themselves the sodium to replace those sodium losses. And what happens in the kidney is now lithium becomes preferentially reabsorbed because there's not as much sodium. The point being is if somebody works out in the hot sun or they have a lot of GI issues, you don't have to stop their lithium. What they tell them is don't just drink water. Get one of those electrolyte solutions. In the US, we have a brand called Pedialyte. I'm sure you have something very similar there in Australia. It comes in 20 flavors now. They tout it as a sports drink. But the beauty of it is that it has sodium, and that's the educational message to give to patients. If you're throwing up a lot, if you have a lot of diarrhea, you have to go work out in the sun, you want to exercise when it's 37 degrees Celsius, that's fine, go do it, but get your salt. Don't just drink plain water. There is some absorption later on the kidney in the what we call the ascending limb. That's a site of action for loop diuretics like furosemide. But most of the harm of where lithium causes problems is the very last stage of the collecting duct. And we'll talk about that in a section. Most of the drug-drug interactions, though, really happen proximally. And it has to do with agents which alter renal blood flow. Non-steroidals, antihypertensives, they alter blood flow, and those are things which result in lithium toxicity, but they're all generally manageable. You just have to anticipate and know what's going on. But this is the story right here. So you're thinking, where is this principal cell located? This principal cell lines the collecting duct. So you can see the collecting duct is really the last step before the tubular fluid becomes official urine. And that collecting duct is lined with different types of cells. There's ones that are called intercalated cells, and there's various types of those. Those are involved in acid-base balance. But where lithium causes its problems in the principal cells. What happens in these principal cells? Well, about 20% of lithium's reabsorption actually has in the collecting duct and is through these principal cells. The problem here is that normally they're designed to reabsorb sodium and water. So you can see the urine stream is on the right. There's an aquaporin channel on the apical surface which reabsorbs water. And then on the basement membrane, there's other aquaporin channels. That's fine. One of the jobs of the principal cell is to reabsorb water. The second job is to reabsorb sodium through this thing called ENaC. ENaC is the epithelial sodium channel. Fine. Normally sodium comes in through ENaC and it gets kicked out the basement membrane through the sodium-potassium pump or another pump which is called the sodium hydrogen exchanger type 1. That's how the system is designed.